So, I tell you the story of ValueCare project, and it is an Horizon 2020 project starting in 2019, December, so 4 years, as Carolina was saying. And where we started from? We started from Michael Porter model, that is value-based healthcare model. I don't know if you are familiar with this model. So essentially, we addressed the call, an Horizon call that was the DTH11, what about the digital transformation in health. So we connected the need to adopt an outcome-driven approach in care in Europe, because there's few experiences around in Europe about value-based model. So we built a consortia that is based on 17 partners, led by Erasmus Medical Center in Rotterdam, so here in the Netherlands, and together also with ECH Alliance and other partners, we started all the job. So what we did, there was two big components, and I tried to address what Carolina was saying. So why and how we hopefully come up with a good solution. On one side, we built a digital environment, having app with chatbot that support people in reaching out their personal outcomes in 7 pilots. So you see, we have created, let's say, a web dashboard for professionals. We gave some devices, but overall, we built the ValueCare application as virtual coach that support people in saying, which is your goal setting, for example, in my cognitive impairment scenario. With psychologists define it, several set of outcomes, and they carry on people in a cycle of weeks with brain training exercises, having remote connection, but overall integrating social care with health. So one successful factor was to connect the two worlds, but as we know, seldom they are separated for several reasons. So there was this digital environment declined in 7 pilots. So we got here in Netherlands, in Rotterdam, the stroke disease and the outpatient care. We got mild cognitive impairment in Treviso, where we are, so in Italy. We got, let's say, heart failure and cardiovascular disease in Rijeka, in Croatia. We got frail conditions in Valencia in Spain and in Coimbra in Portugal. And we worked on integrated care in Cork and Kerry in Ireland. So this is part of a story, but what's going on now and next? We built a knowledge base, and here comes, in my opinion, the 30% of success, but is changing the mindset of managers, care teams in saying how you could redefine your care pathways in an outcome-driven logic. So we came up with a training, with a certification training. We are working on that on July and August for validate this 2 days training about value-based healthcare model decline in elderly care domain. This is important because 90% of value-based healthcare model goes in hospitals, mainly. But how we can talk about outcomes in the chronicity domain? Because if we are talking about healing back, for example, I can broke my arm and I can heal back. I can have surgery about my stomach, I don't know. But if I get demented or if I got a stroke, what is healing? So which outcome we can evaluate? And here comes most of the demotivation of the workforce, because workforce that are quitting our common domain, healthcare domain, needs motivation. And motivation comes from people, and from people come from outcome. So we need to teach them how to see what Porter called wanted variations. We need to teach people how to measure and give value to what matter for people, what matter for staff, and expanding as much as we can these wanted variations. So this is the training about, and the training will lead us to a a service that could be consultancy, could be training. We are, for example, delivering this in Italy in a couple of nursing homes, and my institution as well is adopting a ValueCare model. We see good satisfaction because we give a new framework and a new hope. And recent articles says that the success of value-based model is about management. So we need to have managers who could lead the transition from standard process care towards outcome-driven one. This is a key variable, a key element. We are also ready to deliver a book about all our experience. It will be presented officially on September 12 and 13 in Rotterdam. We will have this large event, all invited. And we tell the story. So a book is about all the job done in the work packages and the partners' activities. So let's say our message is to create a movement around value-based implementation in older care domain. We can start not from the entire portal agenda, but from one point, use of the data, for example, without having new applications or whatever, or just a bit, but having new meaning for the use of the data. I think colleague will talk about this. So this is ValueCare project, and yeah, we would like to share more in the future.
Thank you so much, Oscar. Let me just ask you two clarifying questions. One about the training, like who is the target group of this training, and then the second part maybe on the elements of this web dashboard, if some of those elements are also something that could be put to the market or used in other, I don't know, developments.
Yeah, so the training addresses almost manager and professionals. So, for example...
Healthcare professionals.
Healthcare professionals, sorry, yes. So, I mean, for example, the manager of a care unit in a nursing home, I mean, a hospital or whatever, but mainly in long-term care. And professionals, so psychologists, rehabilitation workers, or the workforce in general, let's say. Regarding the dashboard, so the entire ecosystem will be for free. Let's say the app is online, but what we are seeing is that organization already got information in terms of dashboard, but they don't know how to use it. Mm-hmm. Or they look at the data backwards, but not in let's say, forward. Mm-hmm. So what we can do by the training is saying, guys, you could pick up the most relevant outcome information that you already have, put in the new frame, and use or build your dashboard for the good of a patient. This is the next step.
All right, perfect. Thank you so much. Thank you, Oscar, for the presentation.
Thank you.